Hello, it's Dr. Shelly, and we are here today to finish up our management of care, right? Because you know that there's two other videos. This is the third one. We are focused right now on legal issues. And so the last two videos focused on legal, and we also made sure it was in alphabetical order. It does follow along with the handout. And remember, we have a wonderful special going on until New Year's Day. What is it? It's 7 for $77 because typically I have this pink packet bundle and it's $99. And in fact, that's the only way to get a management of care packet is in that bundle. However, we now have a special 7 for $77. So what do you get? What's the 7? What do you get for $77? Well, first of all, you need to know that this management of care, which is very organized in alphabetical order, has a lot of ethical legal, has a lot of delegation, it has a lot of Sbar and workplace conflict, and just a lot of the things that make up your management of care, which, by the way, is up to 23% of your NCLEX. So we round it off, we say it's 20%. The who you see first, the prioritization and delegation, believe it or not, is in the famous Oh My God packet. So in this packet is, as you know, the #1 study guide in the world for how to pass the NCLEX exam without spending money on a big, huge NCLEX review course, but instead using the free videos that we and other people have. I mean, you know, other people have really good videos too, but using those free YouTube videos with the study guide and some software to get you used to questions. We teach you how to pass your test, whether you failed 10 times or you're taking it for the first time, or you're not taking an NCLEX at all. You hope to get there one day, but you're trying to pass a HESI. Well, this is how you do it, the famous Oh My God packet. So you get the management of care, which is #1, and then you get the Oh My God packet, which is #2. And then you get this, which is #3. And remember what's so particularly big time special about the reduction of risk, which is really procedures. What is so special about that packet? Well, this is the #1 area of failure along with basic care and comfort. And you guys got to remember, because you kind of forget sometimes when you request a basic care and comfort packet. No, there's a basic care and comfort video, but basic care and comfort is included in both of these packets. Diets, nutritions, positions, a lot of what you need is already in the Oh My God packet. And then this buddy comes along and finishes up any kind of basic care and comfort that you didn't have already in the Oh My God packet. But this packet, this reduction of risk and procedures has everything. Like, it has the blood administration, it has the central lines and TPN and PICS and ports, and it has intravenous infusions and phlebitis and infiltration and extravasation. It has medication administration, whether it's an EpiPen or Emla cream as a topical anesthetic. It has all the neuro procedures. It has the EEG, the EMG, the CT, the MRI, all of that, Glasgow scale, log rolling. It has the cardiac procedures, the TEE, the other cardiac procedures. It has, it has EKGs in there. It has the Muga scan. It has the echo. It has all of that. And it goes with videos that I already have for you. It has the genital urinary procedures, the Foley catheter, the dialysis. It has your wound drainage systems like your Jackson Pratt, your HVAC, your biliary tube. It has everything, you guys. I mean, I don't know how much better to tell you this, but everything you could ever do as a procedure is kind of in here. Your trachs, your endoscopies, your colonoscopies, your ileostomies, your your stomas, right? So your care of the patient that has a stoma, the care of the patient that's getting an ERCP. For so many people, you didn't even know what that was. That's in here. How to do chest physiotherapy, how to do the meter dose inhaler. I mean, everything is in here. I mean, really, you'd be crazy not to consider purchasing this. So this is included, and that is packet number 3. Okay, now this is your infectious disease and transmission based protocols or precautions. This is your contact, your droplet, your airborne, how to put on the PPE, how to take off the PPE. All of that is in here. Included in this packet is the list that you need to make flashcards for, right? You, not me, you. And here they are. All of these diseases in one way, shape, form, or fashion have been on the HESI, the NCLEX exam, and you had to know what precautions go with them, what medications treat them, what population is at risk for them, what the picture of it looks like. Oh yeah, there are pictures on your test. Okay, so then we have our fifth packet. Oop, my bad. So what do we got so far? Let's make sure we're keeping up here. Yeah. We have our 5th packet, which is the 2024 newly updated medication categories. And this has everything. It's got your antihypertensives, your psych meds. It's got your beta blockers, calcium channel blockers, your ACE inhibitors, your ARBs, your diuretics, loop and otherwise, thiazide diuretics. It's got your antibiotics, your antifungals. It's got your statin drugs. It's got your antidysrhythmics. Yes, adenosine. Everything's in here, honey. It's got your GI medications. It's got your ADHD drugs. It's got your TB medications. It's got everything. Your antacids, your antivirals. It's really good. I'm not gonna lie to you. I put my foot in this bad boy. It's got your steroids, your DMARDs, your biologicals, everything. 2024, baby. Okay, so that was number 5. And then, if you noticed that little stack I just went through, those are some of the categories that people fail on their candidate report, like the actual categories that people fail. Well, this is yet another category that you fail. And so included in the 7 for 77, these are the last 2 that make 7: psych meds and psych as a condition, as a category with all the conditions in it. And don't get it twisted. These go with the free videos that I put out, and I have over 400 videos, and they're very much organized, not like any other channel on here. They are organized by playlist. So let's get started, shall we? All right, so here we go. This information, by the way, is completely in its entirety in the management of care packet. What do I mean by that? Well, I did it by alphabetical order, and I'm going to show you. We have already done 2 videos, and we have covered all of these alphabetical issues, and we are going to be finishing up some of this alphabetical issues, and it is only the legal part. I already have a video for management of care that deals strictly with prioritization. I'm about to have a video that is going to be strictly delegation. I'm about to have another video that's strictly ethics. This, my love, is strictly legal. So if it's a law and you got to follow it, or you could be in trouble if you don't, I pretty much covered it in the last 2 videos. This will be the 3rd. So here we go. We are looking at right now malpractice, right? So malpractice and negligence kind of overlap, make everybody crazy. You're like, what the hell's the difference? Okay, so think of it like this. Negligence is a failure to do something. It's a failure to do something you should have done. That's all it is. Malpractice is the failure of a professional to do something. So you add the word professional and boom, you got it. So I could be negligent if I don't feed my kids. Duh, I failed to do something. The nurse could be negligent if she didn't do wound care. Duh, that's negligence. But when the nurse did it, she also committed malpractice because she's a professional. And if, are you ready for this? And if that failure to act as a professional ends up injuring or harming or killing someone, that's a lawsuit. Okay, so remember I said that. So watch this. In order for there to be malpractice, there must be a type of negligence, that's one, by a professional that had a duty to the patient, that's two, and they failed to act, and that failure to act or breach of duty caused injury, death, or harm, that's three. So injury and damages. And it has been proven that her failure to act caused it. There was a causal relationship. Okay, so let's talk about this. I remember a patient saying, I'm suing all of y'all because y'all's little stupid O2 mask gave me herpes. Okay, so the patient thinks that the O2 mask gave them herpes. They think you put a mask on them from some other patient and you gave them herpes. So they can sue all they want, but they've got to prove that there was negligence, failure to do something, which I guess that would be failure to get a new mask, clean. Who knows what they're talking about, because patients are crazy. Some of them are just crazy. All right, so maybe there was failure. Maybe that little part could possibly have some merit, and that it was a professional that failed to do it, so the nurse or doctor or whoever, and that it caused injury or damages. Well, come on, people. Everybody and their mother-in-law knows that herpes, really? Herpes is not caused by an oxygen mask. So they would not have any merit in a courtroom. It doesn't stop people from suing. People sue all day long. And if they can find a dummy attorney to take the case, even if it's stupid, they might have a situation going on there. But they still got to prove it, right? They got to prove a causal relationship. You got the herpes from the mask. Yeah, not going to happen. Okay? So just remember that, okay? Now, let's take it a step further. You have your negligence, which is failure to act or do something. Then you have your malpractice, because your failure to act or do something caused harm. And it was proven that, you know, whatever you did caused that. Whatever you failed to do caused that. Okay. Now let's take it a step further. The wrongful act, which is negligence and malpractice, those wrongful acts can lead to something called a civil action or a tort. Oh, you got to know what tort is. It is a wrongful act that leads to a civil action. In essence, it's the lawsuit, okay? So a tort is nothing more than a lawsuit, and a lawsuit is civil. It's not criminal. Criminal is separate. You saw with Redonda DeVault that we are now at very big risk of having to worry about criminal. But for the years that I've been a nurse, it's always been about lawsuits, which is a civil tort. Okay, I hope that's clear. There are two types of torts. There's the unintentional, and that is where whatever happened, whatever negligence that took place, whatever malpractice that resulted, these are not done on purpose. This is unintentional. You did not go to work that day and say, you know what? And we'll use the example of Redonda DeVault. She did not wake up on that day and go to work with the sole purpose of, I think I'll just not remember or even care about the generic name for Versed, and I will go in the Pyxis and pull out a medication that is not Versed. Instead, it's a paralytic agent that is going to kill a 73-year-old today. I think I'll go to work and do that. No, nobody would do that, right? So most of what nurses and doctors get in trouble for is an unintentional tort. Intentional tort is seen as, oh my God, you have lost your mind. And what are those, right? Well, one big one is false imprisonment. And I say that because earlier we talked about certain drugs, when you give them, they're considered a chemical restraint. And we've also talked about the fact that our elderly patients should not be given antipsychotics or benzodiazepines. See the benzodiazepine video. They should not be given those types of medications to keep them in bed or to make them behave or whatever, because they're not for that. Those medications are not for that. Okay, that is not what we do. We have to use alternatives to help our patients, stay in bed, bed alarms, call the family in. We even have, when it comes to that, distractions, what we call a busy blanket where it kind of distracts them, a doll of some sort, folding towels, some alternative. But you can't just go, she ain't in the bed, she won't stay in the bed, I'm tired of this mess, it's night shift, ain't nobody got time for this shit, and you just drug her ass up. No, that ain't a good idea, okay? So that is false imprisonment because that's called a chemical restraint. Okay, assault and battery. Now, we already talked about this. I told you assault was threat, battery was actual contact made that the patient didn't want. And we said in nursing, these types of things that happen in nursing usually are you put an IV or a Foley or an NG in somebody that didn't want it. Yeah, and they had full competency. And so there was nothing else you could call it but battery because you did this against their will without their consent. Hello, you already know what that is. Battery is serious, okay? So that's called an intentional tort. Like, you could get in major trouble for doing that crap. Okay, now, violation of privacy. Well, I mean, we all know what this is, but let's just be real specific because some of y'all is crazy. Such as putting stuff on Facebook or Instagram, or you call yourself going to do a little Snapchat. Okay, well, that is a violation of privacy. It's breaking the law with regards to HIPAA. Talking about patients in the elevator. I mean, you already know this. You knew that anyway, okay? So a violation of privacy. And if you're derogatorily talking about somebody, it could be a defamation of character. So, the defamation of character takes it a little bit further, right? It's the whole slander or libel that we, talk about. And just remember that these two words, the whole slander and libel, because they're right here. And I want you to kind of look at them closely. Libel is library, right? That's the way to remember it. So libel, library, is the written word. This is to all y'all Facebook and Instagram players that want to put shit out there about the patient. That's what you're doing with the libel, okay? Now, slander, S for slander, S for what? Speech. You're talking too damn much in the elevator about so-and-so and such, and this is what it is, okay? So slander is speech, libel is library or written word. Both are causing defamation of character, and here you are with an intentional tort. So get ready for your little lawsuit, okay? All right, here we go. Let's do a little bit further, going on up in here. Now, in addition to a nurse catching a case, catching a civil case, not criminal. Civil cases are torts. In addition to a nurse catching a civil case, she could catch a criminal case, right? I mean, we saw that with Redonda DeVault. We saw nurses step up and pay all her legal bills because we felt strongly that, doctors make mistakes and they're not dragged off to jail. And here they were going after this nurse, trying to drag her off to jail for what would be ordinarily an unintentional civil tort. And so we were like, oh, this doesn't feel good. It doesn't seem right. It's like heavy-handedness. But now remember, a patient did die. So, you know, the public doesn't have a lot of tolerance for that. So you may see more criminal cases resulting of unintentional torts, right? But we will say this, we will say that, you know, typically it's a lawsuit that we see the most. It's not this whole criminal thing. But I would be careful because, again, what we saw with her probably is going to continue. Just saying, watch yourselves before you wreck yourselves, right? Okay, now, let's say that you weren't doing anything that was criminally violating a crime. You weren't doing anything that technically could have been a lawsuit, but maybe you were doing some things that were just as bad or crazy. What would that mean? That would mean that if the action that you partook in was unsafe, unethical, incompetent, or outright abandonment, and let us never forget drug diversion, falsification of records, practicing out of your scope, unlawful in any way, which we said was criminal anyway. But if you have any of those, and I'm going to do those again because they sound like a select all, honey. If the nurse is doing something unsafe, just outright unsafe, unethical, incompetent, or she's guilty of abandonment. We talked about that in an earlier video. Maybe she's stealing narcotics, which is drug diversion. Maybe she's falsifying records saying that she gave a medicine when she never did. Perhaps she's practicing out of scope. She is, you know, doing a circumcision or doing some type of surgery or just crazy stuff. Folks be doing crazy. Or, of course, the worst of all, an unlawful act that had nothing to do with her actual profession. What would those be, Shelly? Well, number one is a DUI. Yeah, nurses, number one criminal act that's reported to the Board of Nursing is DUI for y'all. What's the second one? Well, it's kind of sad. It's actually very sad. It is child endangering. And you might go, huh? What are they doing? Are they leaving their kids at home while they go work? No, actually they're not. That's not what you get in trouble for as a nurse. You do, but I'm saying that's not the type of child endangering that we see. This is even sadder. The nurse is involved in a relationship that is full of partner violence, intimate partner violence, which is the new term for domestic violence. And she may be getting the crap beat out of her. But whoever called the police, whether it was her or somebody else, once the police arrived, there was a child underage in the home during this nonsense. And depending on how the officers feel when they arrive, they may just slap a charge on both of them for child endangering, for the woman and the man. Whoever the victim is, it don't matter. Y'all both getting charged with child endangering because an underage child is in the home with all this hot mess going on. Now, it's sad because technically that term is very true. You know yourself, I know, I've seen it in my own family's life and even in mine, that if you grow up in a home where there's constant violence, intimate partner violence, domestic violence, what happens to a lot of those children? Well, the male may turn around and perpetrate this behavior when he becomes in a relationship. The female may accept this type of behavior as totally normal and not feel like it's any big deal in a relationship that she's in. So you have endangered these children because you've given them a simulation of a normal relationship in the confines of absolutely bizarre, crazy, chaotic lifestyle that's not anywhere near normal. And because they're growing up in it, and we know that Erickson's stages of development says this child is going to be a culmination of what they saw and learned and heard in their first 5 years on the earth or so. Yeah, it is child endangering technically, but But I'm sorry, when my beautiful student calls me and tells me that her significant other punched her in the eye so hard it came out of the socket and had to be surgically put back in. And then when the cops came, they actually slammed her and this person who did this to her with a child endangering charge. So in addition to going with her eye patch on around to, you know, carry on her life, she has to address this new criminal charge of child endangering because her 6-year-old was in the home at the time it happened, and she's never been hit by this person ever in her life. But that day, he decided to knock her eye out of socket. What is that about? So be careful, nurses, okay? All right, so again, listen to me. You have malpractice, negligence. They usually end up in a wrongful act that the patient may seek civil action. This is called a tort. It could even be criminal, as is the case of Redonda DeVault when she gave that patient that vecuronium instead of Versed, okay? That was a criminal case. She had both, by the way, but that was a criminal case. Or it could be not even one of those, but instead, or by the way, it might not be either one of those, or it could be one of those in addition to that now makes you have to report it to the board. So if a nurse gets in trouble with a civil case or a criminal case, both of these are reported to the board. They're mandatory reporting to the Board of Nursing. But in addition to all that, other actions by the nurse that are declared unsafe, unethical, incompetent, or abandonment, drug diversion, falsification of records, out of scope, practicing out of the scope of practice, or, you know, breaking the laws outside of the confines of nursing practice, like a DUI or child endangering. Those are all reportable to the Board of Nursing. Yeah. So you might be thinking, well, damn, we are held to a higher standard than anybody. And you're right, because by the way, doctors can get away with some of this and not even have to worry about it. But nurses, yeah, you're held to the highest standard of practice. And so you might not be able to go to places you used to go. You may not be able to kick it with people you used to kick it with. And I say this to all of y'all who think it's cute out there to be with some big baller shot caller drug dealer. Yeah, he's selling shit and you benefiting from the shit he's selling. Yeah, let him catch your ass. If they bust that house wide open with you in it, you going down with him. Okay, so was it really worth it? I don't know. I don't think so. I frankly think you make enough money and can make enough money for all your needs to be met. So what is you doing with this hot ass mess? You know, maybe that's how you got down before you became a nurse. But boo, you a nurse now. You don't supposed to be doing none of that. Okay. All right, now moving on. If we look at risk management, which goes with all of this, it is a department in any healthcare facility that is geared towards minimizing the risk of a civil tort or criminal case or unethical behavior or whatever. Risk management is how we reduce those chances in a healthcare facility. The risk manager is responsible for following up on all those incident reports or sentinel reports or never events or near miss events, because that's all the language of risk management. They're supposed to follow those events up by doing what's called a root cause analysis. What was at the root of this hot ass mess? So if we're honest, what was at the root of Redonda DeVault causing a med error that killed a patient? What was at the root of that? I'm going to be real with you. The root of Redonda DeVault's medication error that killed that patient that she almost went to jail for but got probation for 3 years, the root of the problem, she did not know her generic meds. I'm talking to you out there who don't know your generic meds because like I told your crazy behind, part of the 7 for $77 is medication categories. And if you don't know your medications, you could have been a Redonda DeVault. Don't act a fool. You better get on the meds. And by the way, the NGN NCLEX is more meds and more infectious diseases. Many more than the old test. So come on, guys, let's learn our meds. All right. Now, so that's risk management. They're supposed to use in this root cause analysis, what was the root? What was the cause of the root? What was the root? What was the cause? They're supposed to use in their root cause analysis something called a just culture. A just culture means that we're trying to prevent the next error and we're not trying to shame or blame anyone. That's what we're doing. That you got to remember that. They're going to use a root cause analysis to figure out how did this happen using a just culture, which means no blame or shame. Okay. Now, how do we prevent the civil tort or lawsuit? Lots of different things. First of all, you got to know what causes most of the lawsuits, right? Well, there's a lot of lawsuits out there. Falls and med errors are at the top of the list. If you think about what happened to Redonda DeVault, oh yeah, that was a med error. It was a deadly one. Failure to monitor and assess is another one. Failure to monitor and assess is another one. So you want to make sure that you practice as much prevention as you can. Now, I know you heard the typical ways to prevent a lawsuit. Practice within the standard of care. I should say follow the standard of care. Practice in your scope. I call it SOC, DOC, and COM, okay? So SOC is standard of care, follow it. DOC is document, but COM is communicate. Communication errors are at the root of a lot of deaths and injuries that occur in healthcare facilities. The failure to give a good handoff report. Your Sbar sucked, so the doctor did not understand what you needed from him or her. Okay, so that's, hey, come on. Faulty equipment is another one, or using equipment for something it really wasn't meant to be used for. But here's the thing that I've learned, because I've been doing this really long time. The number one way to prevent a lawsuit, and you're not going to read it in any book, and you probably have never heard it from any instructor, and perhaps you won't see it on anybody's software, is to freaking love your patient. When your patient perceives that you are there for them and you care about them and that you would never hurt them to save your life, when the patient perceives that, when you are showing that everything you're doing is out of love and concern for them, they don't tend to sue you. And you take that from my heart, because I've had two situations in my career, my long career, where I could have been easily sued. One lawsuit was outright dropped when they found out I would be the one that they were going to be suing. They didn't know that. They were like, no. And they were told that they were pretty much going to get a couple million. They were like, nah, I'm good because she saved my baby's life. Okay. So when you love your patient, they don't sue you. And I have never been sued in my life because I do love my patient. And if you don't, get the fuck out of nursing, because you don't belong here. You wanted to go into nursing because you were the nurse with the purse or Hank with the bank. Get the fuck out of here. Yeah, why don't you go drug deal? How about that? That might be a good plan. Okay. All right, now, so back to the board, because you know your girl be getting a little distracted, and I'm hoping y'all stay focused. Here we go. Some of the other ways to prevent your lawsuit or criminal, cases and all this is giving a good Sbar or handoff report. Remember that Sbar is typically how you call a provider, but it's also what report is given when you transfer the care of the patient to someone else. It's the same for both. The handoff report may be exactly what you're doing, but it should be based on Sbar. So I may be giving handoff report to the nurse, but I'm also following the principles of Sbar, right? So the situation is the S, and that's where you're telling them where the patient is, what your name is, what hospital they're at, why the patient was admitted, what their major things are that, they came in with, whatever, okay? And then background would be where you are giving them basically what is happening since then, what's going on with the patient, and also any kind of comorbidities. Okay, so the assessment is why you really were calling, like what made you freak the fuck out to call you, or, you know, what is it in this assessment that's going to need attention yesterday? And then the request is really clear. Now, let me tell you, the clearest one you got to be sure you do correct. You have got to get good at saying, I need you to come to the bedside and evaluate this patient now. I'm going to say that again. The request. Sometimes the hardest part for the nurse is the request, because you're not clear. You're not being like real clear. I need you to come to the bedside and evaluate the patient now. Hey, 3 in the morning, you got to be clear. Okay, so that should help a little bit. So that's your Sbar. Something else that I have seen is read back. OMG. In my field that I do procedures, and because of that, I do procedural sedation. This morning I was at work doing procedural sedation, and I was very clear, and it was comical in a way, because I had the patient, we're in the operating room, I'm getting ready to prepare them for their scope, and the doctor says, and I don't know what he thought, but the doctor says, I need another 50 and 2. I said, another 50 and 2? I never heard an order for the first one. So between us wearing masks and all the things that go on in an OR and all the noises all around us, I ain't heard nothing. And I said, I'm sorry, doctor, but I didn't hear the first order. You want to come again? Are you saying you want 50 and 2, 50 of fentanyl and 2 of Versed? Because that would be the first one I ever gave. I never gave any. This is not another. This is the first. He's like, oh, okay, no problem. I said, thank you. And, you know, I even thanked him for his patience, because I don't know when he gave that order, but I ain't heard nothing. Okay, so I gave the 50 and the 2, and when you read this back, he says he wants 50 and 2. The problem I see with procedural sedation sometimes where I work is they say 50 and 2, 105, 50 and 1, 50 and 2. I mean, here's my thing. You can roll like that, which is not very helpful, by the way. But if you want to roll like that, I'm not finna roll like that. Here's how I'm going to do it. Oh, okay, so you want 50 of fentanyl and 2 of Versed coming up. And when I give it, I'm giving 50 of fentanyl and 2 of Versed. Finish. Okay, she got her 50 of fentanyl and 2 of Versed. I'm going to keep saying that shit, because I need you to know that's what a read back is. Closed communication, a read back. Any order you get on the telephone, you better read that shit back. Any verbal order you get for procedural sedation with all them dangerous drugs, you better read that shit back. Yeah. Scope of practice. Well, let's talk jargon. Let's talk vocabulary. Let's talk words. There is something called the scope of practice. It is determined legislatively, and it is in the Nurse Practice Act that is regulated by the Board of Nursing. So I'm going to go all the way back for you. When I first became a nurse midwife many years ago, we could not even prescribe a prenatal vitamin. So we became legislatively active, because it's not going to do us any good to call the Board of Nursing and say, oh, we know that we should be able to prescribe a prenatal vitamin. Can you change the law? They don't change the law. The Board of Nursing does not change or set the law. They simply regulate it, and they are there for patient safety. What do I mean by that? Well, if you get a call from the Board of Nursing, you better get you a lawyer, because they're not there for you, baby. They're there for the patient, and you're going to need an attorney before you even talk to them. Okay, that was from your girl. So when you see those words, scope of practice or Nurse Practice Act, the Nurse Practice Act is a lot of actual laws that were either changed, modified, or created by the legislature. And who is the legislature? Because that y'all seem to have a problem with understanding government. Every scope of practice, every Nurse Practice Act is determined by the state. The whole point of the Nurse Practice Act is for patient protection, and it's determined by your state. My State Practice Act is nothing like yours if you're in Florida or if you're in Texas or if you're in California or wherever you are. They differ by the state. That's why what one LVN or LPN can do in one state may be slightly different from what they can do in another state. Their scope of practice may differ based on the state that the nurse is in. So when you travel abroad and go work somewhere else as a nurse, you better know that Nurse Practice Act and that scope of practice, if that makes sense. Okay? But just remember, the scope of practice or the Nurse Practice Act is out to protect the patient. Has nothing to do with your wishes. So when I could not prescribe a prenatal vitamin, I decided to, number one, find out who my state legislator was. So state senate, state representative. Has nothing to do with the federal Congress, the federal Senate, okay? Nothing. It's a state issue. So I found out who that person was. I wrote letters with my colleagues. We convinced them to look at this law and see how ridiculous it was, because what the doctors at the time were asking us to do was just kind of lie and put it under their name. It's a vitamin. It may sound like a good idea to them, but it's putting our license in jeopardy, and it's falsifying records, which is against the law. Hello. It's like crazy. Okay, so they heard us loud and clear and gave us the right to prescribe, but not after a lot of hard work of lobbying, there's a word, lobbying on behalf of what laws we wanted changed as advanced practice nurses in the state of Ohio. All right, so that's the deal. Now, let me just say something about the Nurse Practice Act that is true for every single state. It is against the law to refuse to float. Just in case you were confused and thought that you could tell somebody out your mouth that you're not about to float, you better think again, because your ass gonna be in big trouble. You know, I'm just trying to save your ass, okay? All right. Now, there is something called the nurse's duty to report. So I want to go over that because you know by law, you are obligated to report several situations. You are obligated to report suspected child abuse or elder abuse. So any child under 18, any elder person over 65. If it's a child, it's Child Protective Services. If it's an elderly person, it's Adult Protective Services. You are obligated to report death from crime, trauma, suicide, unexpected accidental hospital death from something possibly that happened from something we did. You are obligated to make sure that that's reported to the medical examiner. And for the record, in the Redonda DeVault case, that death was not reported to the county coroner, medical examiner, whatever you want to call it. And the cause of death was reportedly lied about. Yeah, all right. Now, you're also obligated to report certain STDs, and we talk about that in the infectious disease lecture, but you are obligated to report that. Okay, so duty to report is a big one. And by the way, this is important. Notice the word says suspected. You don't have to be right. You could be completely wrong, but suspected abuse of a child, suspected abuse of the elderly patient. I mean, the elderly persons, okay? All right, so you could be really wrong, so, you know, whatever. Now, I want to go over something else before we're done. Workplace conflict and restraints. Restraints is so serious. It's a separate video all on its own. But workplace conflict is complicated. I find that with management of care, these terms on the board are tricky, and they're tricky the most with English second language students because the culture is very different from where they may have been born, and the vocabulary is super different. So when I'm looking at all of these terms on the board, the person that has the most trouble understanding them is the English second language student. So I want you to know that workplace conflict can be confusing to everybody, but especially the English second language student. So let's just look at some of this, okay? Workplace conflict. Bullying. Bullying is very much alive and well in the career of nursing. It could be from your doctors, it could be from fellow nurses, it could be from your charge nurses. Bullying is alive and well. And so you feel like this person, every time you work, is basically making you, through their verbal and nonverbal actions, making you do certain things that you don't feel comfortable doing. Probably the biggest one I see with the whole bullying is that it's real cliquey, and every time you work, you get the worst assignments and there's nothing you can do about it. It's like, wow, I'm just fucked. Every time I show up, they're gonna dump on me and give me all this crap, and I can't do anything about it because they're a bunch of bullies. Like, they yell at me, they say derogatory things to me, they're just not nice at all. I can't approach them. It's awful. Yeah, you need to hurry up and get out of there, okay? It's too many nurses' jobs out here for you to sit up under bullies, okay? But then make sure you give an exit interview and report it. Horizontal violence is actually becoming really, really common. That is where it's nurse-to-nurse violence. Hello? Can we stop, please? We're adults. But if you think about it, it's just reflective of society. Society is more violent, and of course, nurses are part of society. So here we go with nurses being out of control and violent. It's crazy. Horizontal violence, nurse to nurse. Illegal acts and unsafe acts. I want to cover that. You're in the workplace and you see somebody doing something illegal. Do not confront them. Go directly to the supervisor and let them know. Don't confront them. No, we're not doing that. So impaired nurses doing illegal acts, we are not confronting this, okay? We are going straight to the nursing supervisor. Unsafe acts, like breaking sterile field, or that's probably the most important one I can think of right now. Or laying the patient flat when they have a respiratory disorder that they can't lay flat with, that kind of thing. Intervene. The way you handle that, you intervene, confront that nurse, intervene right then, stop it, okay? So sterile field, maybe they're putting in it doesn't matter who it is, doctor, nurse, whatever, intervene, stop it, okay? If no one is in harm's way, there's no illegal acts being done, no one is in harm's way, but the behavior is not appropriate or just outright, maybe even unethical, you need to confront that person face to face, you and them, privately with a discussion. An example of that where, no one's in harm's way is every time you work with this person, they come in late and you get relieved late for your patient care, handoff report, whatever. They never are on time, ever, like ever, okay? In my case, I had a traveler who every time I got report, it was some bullshit and chaos. Nothing was ever done. So I got to the point where when I came in, I looked directly at who I was going to be getting report from, and I knew that person was a problem child, and I stopped taking report from that provider or that nurse. So this went a little something like this. Okay, can you make sure that before you give me report, you make sure that the blood that was ordered 12 hours ago gets drawn, and that the patient's central line dressing is changed because it hasn't been for a while. And then once you're done with that, come find me. I'll be ready to take report. Yeah. Okay, so that's a good example. It's a private discussion, quiet and professional, but fuck you and fuck this if you think I'm gonna do a jump in this hot mess you left me. It's not gonna happen. Because once you take report, that's your patient. Okay, now listen, you remember the 7 for 77? If that's something you're interested in, stay with your girl. Look at here. 2 1 6 4 1 0 0 9 3 6. Give me a call. No, I lied. Don't call me. I'm never going to answer anyway. Text me. And I will try to get to you in about 48 hours with your goods that you want. I take PayPal and Cash App. I do not take Zelle. Stop asking me that, because I don't. And I love you, but deuces. I'm out. And Merry Christmas if I don't see you or talk to you.